How you guys doing? Dr. Martin here. And so I want to talk about an aspect of pain, or treating an aspect of pain, that's often overlooked. And that aspect of pain is going to be stress and the stress response. So historically, throughout human evolution, when a person was in pain, that meant it could be a potentially life-threatening situation. And it could still be a life-threatening situation now. But if a person had pain, there would be the activation of the sympathetic nervous system releasing adrenaline, and that would help a person to defend themselves if they needed to, or to escape the situation. Nowadays, we don't have that as much. We have pain, but we have it because of kind of silly situations sometimes, or because, some kind of accident happened or something like that. I dread going to the massage therapist and filling out those forms because, they ask about, oh, what kind of chronic pain do you have? And I'm like, oh, yeah, I check off the box for chronic pain in my shoulder. So I've got chronic shoulder pain because I dislocated my shoulder playing football. So I'm like, yeah, old football injury, right? And then they're like, oh, you got chronic hip pain. Tell me about that. Well, yeah, I've got chronic hip pain. And why do you have chronic hip pain? Well, it's an old dog walking injury, right? And I always get that look, right? Dog walking injury? Really? Come on. And so, yeah, I was walking the dog, and the dog took off after a rabbit, and I just basically, busted it and bit it, and it wasn't a good situation. So, yeah, I do have chronic pain because of an old dog walking injury. Whatever. Anyway, so when we are in pain, pain is going to promote adrenaline release, so we are going to be a little bit more irritable and things like that. So an important aspect of treating pain is not just to reduce pain, but also to help treat the stress that goes along with pain. And I remember when I was an intern in a master's in acupuncture program that I took, Dr. Kim always said, anytime you treat any condition, but especially pain, make sure you're using points to promote relaxation. So if you yourself are in pain, or if you have a patient that's in pain, it's always important to treat the pain itself, but also use something that's kind of relaxing that can help treat some of the stress that goes along with the pain. You got your bromelain, you got your turmeric, you got your boswellia, or your NSAIDs if you're going to do that to help deal with the pain, but then use something like a chamomile tea, or a jasmine tea, or maybe a lavender tea or something like that to help promote relaxation. Do aromatherapy or whatever. Getting a massage, getting acupuncture, even an adjustment can all be beneficial to help you to deal with the pain and reduce the stress overall. So don't forget to treat stress associated with the pain that a person's going to be experiencing. All right, so I hope that you found that helpful, and have a great rest of the day.